Thank you for watching this video abstract on initiating occupational and physical therapy in the hospital after birth, with a focus on access, reimbursement, and outcomes. During the first 42 days after birth, individuals are at the highest risk of returning to the hospital for postpartum preeclampsia, infection, and cardiovascular conditions. Over 50% of maternal deaths occur before the 6-week postpartum visit. We discuss how traditional acute care therapy services can screen body systems during the maternal hospital admission to enhance recovery and safety prior to hospital discharge. Rehabilitation screening approaches for the maternal population are detailed as they pertain to cardiopulmonary, neurologic, musculoskeletal function, and mental health. Co-authors outline specific interventions that reduce risk for postpartum readmission, improve activity tolerance at home, and decrease healthcare costs associated with maternal morbidity.
Conservative pain management is important for function without the unwanted side effects of medication. Rehab uses positioning, breathing, assistive devices, and body mechanics. Beyond considering access to their home, when discharge planning, rehab needs to consider that the mother is caring for a newborn, other children, or the grief of infant loss. Acute care rehabilitation can provide timely interventions, education, and safety strategies to reduce adverse events in the early postpartum recovery.
One of the most effective interventions therapists can provide immediately is diaphragmatic breathing. The diaphragm plays an essential role during mobility to protect the incision, decrease pain, and indirectly activate the transverse abdominis and pelvic floor. Education should also cover cardiovascular conditioning, energy conservation strategies, and expected recovery milestones. In the inpatient setting, therapy services should empower mothers and medical staff to advocate for therapies to reduce postpartum complications and improve function. Multidisciplinary collaboration is necessary to increase patient access to much-needed therapy services. Therapy services are the gateway to improving maternal care in this country.
When starting an obstetric therapy program at your hospital, you will undoubtedly encounter barriers, including concerns from management about how the addition of PT and OT services to this population could affect reimbursement. In this article, we will give an overview of how acute hospitals are typically reimbursed for maternity care by both Medicaid and commercial insurance. Then we will detail key leverage and persuasion points available to the therapist that is financially justifying their services. Hospital management is often tasked with the competing demands of maximizing both quality of care and revenue. When advocating for the addition of physical and occupational therapy services to the obstetrics line at your hospital, an appeal can be made to both of these demands.
A goal of this paper is to mobilize physical and occupational therapists to advocate for and extend services to the obstetric population in the acute care setting specifically. Acute care therapists are very well positioned to promote physical and mental health and wellness for these patients and to set them up on a path to recovery during the postpartum period. This would include education on their precautions so that they're better able to care for themselves, for their newborn, for other children at home, for specific monitoring of activity tolerance and activity modification as needed in order to better identify risk factors and reduce maternal morbidity during a high-risk time period, and to better prepare them for the functional demands following their discharge, including initiating appropriate referrals to outpatient pelvic health providers as needed. It's our hope that this paper will serve as a call to action to current pelvic floor providers and acute care therapists to form strong partnerships in order to better serve their patients during the antepartum and postpartum period with a goal of enhancing their functional outcomes long-term. And we thank you for reading.